Imagine this. You've been on the same medication for 10 years. It works. You're functional. You're stable. You have your life back. And then your doctor calls you in and says, "We're cutting your dose in half starting next month." Not because it stopped working, not because you did anything wrong, not because you have side effects, because of a policy, a guideline, a number on a chart that some bureaucrat decided was too high. And when you beg them not to, when you explain that this will destroy your life, they say, "Sorry, it's out of my hands." This is called forced tapering, and it's medical torture disguised as healthcare. And if you listen to my last episode about the opioid crisis, you know this is happening everywhere right now to millions of people. So today we're going to go a little bit deeper. We're talking about what happens when doctors forcibly reduce or eliminate pain medication from stable patients, the devastating consequences, the deaths, the suicides, and why no one is being held accountable. So welcome back to Painfully Real. I'm Josh, and if you're new here because the last episode went a little viral, welcome. Buckle up. This one's going to be even more uncomfortable. Today we're exposing forced tapering, the practice of reducing or eliminating pain medication from patients who are doing well on it without their consent, often rapidly, and usually without adequate support. This isn't medicine, this is torture, and it needs to stop. So let me be crystal clear about what we're talking about. Forced tapering is when a doctor reduces or eliminates your pain medication without your consent. This is done despite the medication working effectively for you, despite you being stable with no signs of misuse. It's often done rapidly, sometimes even cold turkey. It's usually because of external pressure, guidelines, the insurance, the fear of the DEA. This is not the same as voluntary tapering when a patient wants to try reducing medication, or tapering when medication isn't working, or when there are dangerous side effects, when there's evidence of addiction or diversion. We're talking about stable patients, people who've been on the same medication for years, people who are functional, working, raising families, people who are doing everything right, and their medication is being ripped away from them. So why is this happening? It's happening because of a perverse interpretation of medical guidelines. Imagine treating any other condition by forcibly removing effective treatment. Think about this insanity. When doctors prescribe antidepressants or blood pressure medication and they work, they continue them indefinitely because the medications manage chronic conditions. Yet with chronic pain patients on opioids, doctors increase doses until symptoms are controlled, then force tapers against patients' wishes. And let me repeat that. If you have high blood pressure and medication brings it to normal levels, your doctor doesn't say, "Okay, time to taper off because you've been on it too long." Or if you have diabetes and insulin works, they don't say, "Let's reduce this and see if willpower can control your blood sugar." But with chronic pain, doctors provide treatment that works, give patients their lives back, and then take it away based on arbitrary timelines or dose limits. The pressure cooker doctors are being pressured from every direction. Insurance companies threatening to deny coverage or drop them from networks. You've got state medical boards threatening license suspensions, the DEA conducting audits and making arrests, and your hospital administrators implementing blanket policies. Pharmacies are refusing to fill prescriptions. And your quality metrics? Well, that penalizes doctors for prescribing opioids. So what do scared doctors do? They taper patients, even stable ones, even when it will cause harm, because protecting their licenses is more important than protecting their patients. And I get it. I understand the fear, but that doesn't make it right. These guidelines that started it, the 2016 CDC guidelines recommended dose limits and duration limits for opioid prescriptions. These were supposed to be recommendations for new patients. But what happened? The guidelines, though voluntary and intended for primary care doctors starting new patients on opioids, became a rigid template used by states, insurers, and healthcare systems to force reductions in existing patients. Patients who'd been stable for years suddenly found themselves being tapered because they were above the guideline dose. Never mind that these guidelines explicitly said they didn't apply to stable patients. Never mind that the CDC later clarified this was a misapplication. Guess what? Damage was done and it continues today. Let me tell you what happens when you forcibly taper someone who's been on pain medication long term. There's immediate physical consequences. First, you've got the withdrawal. And I'm not talking about addiction withdrawal, though that's what everyone assumes. I'm talking about physical dependence. When opioids are tapered, patients experience withdrawal syndrome characterized by anxiety, hypertension, tachycardia, restlessness, sweating, tremor, nausea, abdominal cramps, diarrhea, insomnia, muscle aches, and dysphoria symptoms that can last 7 to 14 days or even longer. But here's the cruel part. Doctors conducting forced tapers often can't or won't distinguish between withdrawal symptoms and returning pain, yet both require completely different management approaches. Patient says, I'm in agony. The pain is unbearable. Doctor says, that's just withdrawal. It'll pass. But what if it's not withdrawal? What if it's the underlying pain condition, now uncontrolled, destroying the patient? Nobody cares because the taper must continue. Pain returns, worse than before when medication is reduced or stopped. The pain doesn't just return to baseline. It comes back worse. Why? Because your nervous system has adapted. Pain pathways have been modulated by the medication. Remove it suddenly and everything goes haywire. Patients describe pain levels they never experienced before. It's pain so severe they can't function at all. Pain that makes them suicidal. And doctors say, just push through it. Try meditation. Loss of function. Remember, these patients were functional before the taper. They were working, parenting, living life. Forced tapering strips all of that away. Patients go from functional adults to bedbound invalids. They lose their jobs, can't care for their children, can't drive, can't sleep, can't maintain basic daily activities. And doctors call this successful tapering because the dose is lower. A mental health catastrophe. Your research shows that patients whose opioid therapy was tapered or discontinued experience worsened suicidal ideation, pain, function, and quality of life. The psychological impact of forced tapering is devastating. The doctor you trusted is now harming you. You've got helplessness. You have no control over your own medical care. There's desperation. The suffering is unbearable with no end in sight. Suicidal ideation, where death seems like the only escape. One study found that many patients experiencing problems accessing pain carried voice challenges associated with physical and emotional anguish that hindered everyday tasks, and many conveyed experiences of contemplating suicide and seeking emergency care due to inability to obtain medications. So let me say that plainly. Forced tapering is driving patients to consider suicide, and in some cases to actually die by suicide. Patients turning to dangerous alternatives when legal medication is taken away. Desperate people do desperate things. Some patients turn to street drugs where there's no quality control, where drugs are contaminated with fentanyl, where they risk overdose death. Some experts warn that overly aggressive reductions or forced cutbacks have led patients who are dependent on the drugs to seek illicit source of opioids. Think about the irony. We're so afraid of prescription opioid deaths that we're driving patients to street drugs where they're far more likely to die. We're literally creating the outcome we claim to be preventing. Others try to manage with dangerous combinations of over-the-counter medication, massive dosage of drugs that destroy their liver, NSAIDs that cause GI bleeding. Some turn to alcohol. Some, again, attempt suicide. And some succeed, all because they were forcibly tapered from medication that was working. The research confirms it. A systematic review found that evidence on forced tapering is inadequate to weigh benefits and harms, with anecdotal evidence accumulating that patients may be exposed to harms when tapering is conducted without patient buy-in and without additional pain management supports. We have no good evidence that forced tapering helps, but we have mounting evidence that it harms, and yet it continues. And let's talk about the ethics or complete lack thereof in forced tapering. Violation of informed consent. Medical ethics favor informed consent when proposing changes to care that involve meaningful risk. Yet forced tapers violate this fundamental principle. In every other area of medicine, patients have the right to informed consent. You get to decide whether to accept a treatment, refuse a treatment, or continue a treatment. But with forced tapering, patients are told, this is happening whether you agree or not. That's not medicine. That's coercion. Patients describe feeling held hostage, sign the taper agreement, or be abandoned completely. That's not a choice. That's abuse. The do not harm principle every doctor takes an oath. First, do no harm. But forced tapering causes massive harm, physical harm, withdrawal, uncontrolled pain, psychological harm, your trauma, suicidal ideation, and your social harm, your loss of function, relationships, employment, and sometimes death. Clinical evidence to support forced tapers in stable patients is lacking, and such tapers may destabilize patients. So how are doctors justifying this? They claim they're preventing future harm from long-term opioid use. They claim they're protecting patients, but you can't protect someone by torturing them. You can't prevent future harm by causing immediate catastrophic harm. That's not ethical medicine. That's rationalization. The lack of evidence, here's what makes this even more egregious. Studies find inconclusive evidence on the impact of tapers on pain severity, function, quality of life, withdrawal symptoms, substance abuse, and adverse effects with inadequate information on tapering harms. We're conducting a massive, uncontrolled experiment on millions of patients. We're causing documented harm in pursuit of theoretical benefit, violating medical ethics. We're ignoring patient autonomy. We're destroying lives, and we're calling it evidence-based medicine? Who's accountable? Here's the sickest part. Nobody is being held accountable for the harm caused by forced tapering. When a patient loses their job because of forced tapering, nobody's responsible. Becomes disabled because of forced tapering. Nobody's responsible. Is by suicide because of forced tapering. Nobody's responsible. Turns to street drugs and overdoses. That's counted as an opioid death and used to justify more forced tapering. The system that caused harm gets to pretend it wasn't inevitable or the patient's fault or unfortunate but necessary. No accountability, no consequences, no justice. This can't continue. Here's what needs to happen right now. Ban non-consensual tapering. Medical ethics demand informed consent. When changes to care involve meaningful risk, forced tapering must require patient agreement. No more forced tapers, period. If a doctor believes tapering is medically necessary, they must explain why, present evidence, discuss alternatives, get patient consent, proceed slowly with adequate support. If the patient doesn't consent, the doctor must either continue treatment or help them find another provider, not abandon them. We've got to hold people accountable for harm when forced tapering causes suicide, disability, loss of employment, or they turn to street drugs. Someone should be held accountable. Medical boards, insurance companies, prescribers, policymakers, whoever made the decision that led to harm. Right now, nobody faces consequences, and that has to change. We've got to require adequate support during any taper. If tapering happens consensually, patients need slow, gradual dose reductions, frequent monitoring, alternative pain management strategies, and mental health support, because the option to pause or stop the taper if it's causing harm. Evidence shows that patients who participate in intensive pain management interventions that incorporate opioid tapering may experience improvements, but those who taper with less intensive support may have unchanged or worsened outcomes. You can't just cut someone off and say, good luck. It's malpractice. Eliminate policies that force tapering. Medicaid states and private payers still have policies that lead to forced dose reductions, creating conflict between good medical practice and what the system incentivizes. Insurance coverage limits, state laws, capping doses, equality metrics that penalize prescribing. All of these need to be eliminated or reformed. Doctors should make medical decisions based on individual patient needs, not arbitrary policies. We've got to separate stable patients from guidelines. The CDC guidelines were never meant to apply to stable long-term patients. They've since clarified this, but the damage continues. We need explicit protections if a patient has been stable on medication for a certain period with no evidence of misuse. They are exempt from tapering policies, period. No exceptions. We've got to track forced tapering harms. We need data. How many patients have been forcibly tapered? How many lost function? How many died by suicide? How many turned to street drugs? We're conducting a massive experiment. At minimum, we should be tracking the outcomes. Right now, we're flying blind and people are dying. If you're currently being forced to taper, here's what you need to know. You have rights. You have the right to informed consent. You have the right to see your medical records. You have the right to get a second opinion. You have the right to file complaints with medical boards. You have the right to refuse treatment, including tapering. So know your rights and use them. Document everything. Record appointments. Check if your state requires one-party or two-party consent. And take notes. Keep copies of all medical records. Document how the taper is affecting you. This documentation may be crucial if you need to file a complaint, find a new doctor, or prove disability. Get support. Don't go through this alone. Find patient advocacy groups. Connect with other chronic pain patients. Consider working with a patient advocate or an attorney. Make sure you get mental health support if you're becoming suicidal. You need a team, so build one. Know when to fight and when to find someone new. Some doctors can be educated. If your doctor is willing to listen to research, to hear your concerns, to work with you, fight for that relationship. But if your doctor is rigid, dismissive, or clearly operating from fear rather than evidence, it may be time to find someone new. You deserve a doctor who sees you as a partner, not a liability. Your crisis resources if you're becoming suicidal because of forced tapering. The National Suicide Prevention Lifeline, 988. Your crisis text line. Text HOME to 741-741. Your life matters more than any taper. If you're in crisis, get help immediately. If you're navigating forced tapering right now, I want you to know you don't have to do this alone. In my coaching program, I work specifically with chronic pain patients who are facing forced tapers, medical abandonment, and systemic betrayal. We work on advocating effectively for yourself when doctors won't listen, documenting everything to protect yourself legally and medically, finding providers who practice patient-centered care, managing the trauma of medical betrayal and forced tapering, and building resilience while fighting for appropriate care. Help with creating contingency plans if tapering becomes unavoidable, and navigating the mental health crisis that forced tapering often causes. Again, I can't prescribe medication, but I can help you fight for the care you deserve, and I can help you survive emotionally while you're in this battle, because this fight is brutal, and you shouldn't have to wage it alone. Head to painfullyreal.shop and book a free discovery call. Let's talk about what you're facing and how I can help you navigate this nightmare with your dignity and life intact. Because you deserve care. You deserve consent. You deserve better than this. Forced tapering is medical torture disguised as healthcare. It violates informed consent. It lacks evidence. It causes massive harm. And it's happening to millions of people right now. We need to name it for what it is. We need to demand accountability. We need to stop pretending this is good medicine, because it's not. It's barbaric. If you're a chronic pain patient who's been forcibly tapered, share your story. Don't suffer in silence. The only way this changes is if people understand the human cost. If you're a healthcare provider who's being pressured to force tapers, push back. Find ways to protect your patients. Be creative. Be brave. And if you're just learning about this for the first time, share this episode. Make people uncomfortable. Start conversations, because people are dying right now while everyone looks the other way, and we can't let that continue. So thank you for listening to Painfully Real. If this episode made you angry, good. Channel that anger into action. Share this episode. Tag your representatives. Demand change. And if you're in crisis, if forced tapering has you thinking about ending your life, please reach out. At the end of the day, you matter. So hold on, and I'll see you next time.